My name is Brian Gallagher. I'm from Meg Academy. And what I'd like to talk to you about today is marketing. And there's several facets of marketing that are going to make you extremely successful. So let's start off in this 5-part series, getting our head wrapped around this whole concept of marketing. Because there's internal marketing, external marketing, branding, and public relations. All of these things kind of roll together. So first of all, if you're doing internal marketing, it's things that you're doing inside your 4 walls to get yourself better known, right? So this is what I call farming. You're laying down the groundwork. You're putting the message out, you're communicating through several different outlets, most importantly, social media, working through your patients, working through promo and advertisement, right? So that could mean multitude of different things depending on where you are in the country. And the challenges that I see many startup physical therapy practice owners as well as existing practice owners have in their internal marketing strategies is there's no one-size-fits-all answer depending on where you are in the country. What we help our clients, our physical therapy owners do in California is not necessarily what we advise and help them to do in New Hampshire. So the benefit of me being in over 500 offices in every state in the United States except for 4 has opened my eyes to the idea of whether you're a rural clinic or suburban clinic or urban clinic, there's a variation in the marketing strategies that you have to go about. So let's take on one of those particular strategies, and let's talk about the strategy of marketing to physicians. Let's talk about marketing to referring physicians, physicians who can actually refer to you, right? There's other allied health professionals as well, and we'll try to touch on that at the end here. But depending on where you are, marketing to physicians is more or less important depending on your marketplace, right? So let's assume everybody's going to embrace some degree of marketing strategy to physicians. So here's what you want to do. Step 1, you want to create your physician database. How many physicians do you have that are seeing patients within a 30-minute drive of your clinic? Now, the doctor's office, the physician could be an hour away or even an hour and a half away because patients drive up there to see them from your community, but they live in your community. So this is most important when you're in rural markets. These are the physicians that are what we call part of your central file. These are your general referring physicians within your market. Now, if you've been an existing practice and you've been doing this for a while, there's some physicians who've referred to you, but they haven't referred to you lately. You haven't gotten anything from them in the last 6 months, but prior to that, you had some patients here and there. So they know of you, but they're not a consistent referral of you. We consider that your active referring database. Okay, so if you have 900 physicians in your central file, you may have something like 120 in your active referring physician database. Then we look at the third ring, the current referring physicians, people who've been coming to you in the last 30 days or in the last 90 days. Anything in the last 90 days is a current referring physician. Anybody, I would draw the line at 90, anything over 90, but who sent to you in the last year, but over 90 days to the last year is your active referring physicians. And then anybody who hasn't sent to you at all is part of your central file. Now you're going to mix your message according to who that public is, which one of these buckets you're going after. I mean, obviously you're going to be communicating to a current referring physician about their patient care and the results and things that are going on. With your active referring physicians, you need something new and exciting, something that's going to grab their attention, that's going to differentiate you from the competitors. So you're going to need to think about what that messaging is. From your central file, someone who's never sent to you before, it's rapport, it's relationship building, it's get to know you. So what can you do or say that's going to impress them as to who you are and what you've built and why they should take a chance in sending patients to you? So you're going to want to wrap your mind around those kinds of conversations and marketing strategies and communication line, right, to those referring physicians or potential referring physicians here. Now, when you go out, that's external marketing. If you have a marketing coordinator or yourself and you go knock on doors, go visit a physician, bring them bagels, have a morning breakfast or do a lunch, I still believe that those are effective in relationship building. I mean, COVID has set some of that behind, so I'm not crazy. I do understand a lot of people want to have people in their space, but where it's possible and when it can be done. It does build relationships. And when you go and you do that, the message you want to send is that you're just trying to get to know one another. You're just trying to share what you believe in, your philosophy, and the fact that you go above and beyond anything they've probably ever seen. And here's why, and here's what you do. You're not trying to sell to them. You're not begging for patients, and you're not bribing lunch for referrals. I know a lot of people will say that, and it's a lot of that cash-based argument. It's not true. All of us are looking for someone who can help our patients get a better outcome, us included. We're referring people out all the time. So that's my message. That should get you started. Know how to actually build that referral database of physicians and know how to go after each one based on which bucket they're in, current, active, or central file. If you felt that this one really helped you and you like this part 1, please hit the like button, hit the subscribe button. Do give us a thumbs up. It's that algorithm thing, and it really does help us get noticed. And if it helps us get noticed, we can help more people just like you. Greatly appreciate it. Thank you so much for your time. I hope you enjoy our channel.